In this video, I will describe what a normal, healthy period should look like. You will learn what is normal, but more importantly, what is not normal and what you can do about it. By the end of this video, you will know the 9 signs and symptoms to track each menstrual cycle to help you identify if your period and your menstrual cycle are healthy or not. I have been a naturopath for over 10 years now, and it never ceases to surprise me what women put up with every month. What surprises me more is that most of these women don't even know that what they're putting up with is not normal. It's just what they're used to. I can't tell you how excited I am to empower you with knowledge about your period, what's normal and what's not. Before we get into the 9 signs and symptoms you should track every menstrual cycle, I feel like there's a little bit of background information we should get through first. What is a period? Your period is what happens when you bleed. It is the most obvious part of your menstrual cycle. And in a healthy period or a healthy menstrual cycle, you will get your period and bleed approximately every month. And your period happens because pregnancy didn't occur that menstrual cycle, and the lining that was being prepared by your hormones to nourish a possible fertilized egg is no longer needed, so the lining is shed. This bleed happens within your menstrual cycle, and your menstrual cycle is controlled by a series of hormonal events that happen from one period to the next. These events include 1, your period, 2, the follicular phase, which leads to 3, ovulation, and after ovulation you have 4, the luteal phase. When pregnancy doesn't happen, the lining will be shed and your cycle will begin back at your period. Please check out my previous videos, Anatomy and Hormones and Menstrual Cycle Explained, to get a full explanation of the hormones, the phases, and the menstrual cycle. Even though your period is the most noticed event that happens within your menstrual cycle, and sometimes the most troublesome, the main goal of your menstrual cycle is ovulation. And this is where the egg is released each month. In a healthy, regular menstrual cycle, ovulation will take place once a month, which indicates balanced hormones and greater chances of pregnancy. Now, I know you might spend most of your life trying not to fall pregnant, but a healthy menstrual cycle and a healthy period is just one way of telling us how healthy your body is. And it certainly tells us how healthy your hormones are and gives us information about your future fertility. If you are trying to conceive, then it is even more important that your menstrual cycle and your period are healthy. In this video, I am going to share with you the 9 menstrual cycle signs and symptoms to track every cycle. By tracking these signs and symptoms, we can see if you suffer from a possible hormonal imbalance. We can attempt to identify the cause and treat the problem to give you health and fertility. Now, the first menstrual cycle sign to track is the length of your menstrual cycle. The length of your menstrual cycle will be counted from day 1 of full menstrual flow, or day 1 of your period, and it will last until the day before your next period begins. Now, the considered normal length of your menstrual cycle will depend on what stage you are in life, whether you are a teenager or an adult. I'll first talk about what is normal and what is expected for teenagers. Now, for teenagers, the follicular phase, which was the second hormonal event that happens within each menstrual cycle, this follicular phase can be longer because it takes a longer time for ovulation to take place when the hormonal system of teenagers is still maturing. Therefore, a healthy menstrual cycle length can be anywhere from 21 days to 45 days. When a teenager first gets their period, it is normal to be irregular. They could experience as little as 2 bleeds in the first year. And after 2 years, your menstrual cycle should start to have a bit of a regular pattern, and it can take up to 4 years to be regular and what is normal and healthy for you. Now, for adults, a healthy menstrual cycle length can be anywhere from 21 to 35 days. 28 days is what they consider average or a textbook menstrual cycle. A menstrual cycle length that is not normal and not considered healthy is anything that is shorter than 21 days or longer than 35 days. So let's explore the menstrual cycle length a little bit more. Regular menstrual cycles and periods suggest that ovulation is happening. And in order to have balanced hormones and optimal fertility, ovulation must happen. If you have irregular cycles, short or long, or absent periods, this suggests ovulation dysfunction. And we want to find out the cause so we can better balance your hormones and regulate your menstrual cycle. The length of your follicular phase can vary depending on many things. The luteal phase, however, which happens after ovulation, typically doesn't vary any more than 10 to 16 days because the luteal phase depends on the lifespan of the corpus luteum. In a healthy cycle where your menstrual cycle length is 21 to 35 days, your hormones are better balanced and you should be able to predict ovulation. If your cycles are short, so less than 21 days, this could be due to a short follicular phase or a short luteal phase. Long cycles that are longer than 35 days could be due to delayed ovulation. Here we usually see a longer follicular phase with a luteal phase that is a normalish length. It is possible to have long cycles where ovulation doesn't occur at all. If ovulation doesn't happen, then the corpus luteum won't be formed, you won't have progesterone being produced, and then there will be no luteal phase. Your body could be in a perpetual state of a follicular phase. You could either have a total absence of a period because you haven't ovulated, or you could experience a bleed, but that's simply because the lining eventually has to shed because it's still being stimulated by estrogen. With the assistance of an experienced hormone healthcare practitioner, we can help you identify the cause by charting your menstrual cycle and then provide the right treatment. And you don't need to do this alone. If you are interested in learning how to chart your own cycle, then in the description box below, there will be a link to my course, Master Your Menstrual Cycle. So you can check that out. But whatever you do, just start tracking your menstrual cycle right now. The easiest way to track is by using a period app as you carry your phone with you everywhere. The first day of heavy bleeding, you will mark in your period app as day 1 of your menstrual cycle, and the next time your period comes, you will enter this again as day 1. And the app will do all the work for you, and it will track your menstrual cycle length as long as you remember to enter your period when it comes. You can also use a calendar or a diary to mark your period when it comes every month. That is just as easy. In the near future, I'll release a video and cover all the reasons why your period could be late. So if you have a long cycle, subscribe and hit the notification bell so you will find out when that is released. The second period sign to track is your actual bleed, so your actual period. Your period should start right away. No spotting. It's first really important for us to understand the difference between full flow period and spotting. Full flow is described as red blood, and full flow should require you to wear a sanitary item, either a tampon, pad, or a menstrual cup. Spotting is light bleeding that occurs between your menstrual cycle, or it can happen just before or just after your period. Spotting should be very minimal blood loss, mostly consisting of droplets of blood that can be a light pink tinge or a brownish color. And this could be seen as you wipe with toilet paper, or droplets of blood might even mark your underwear, but it shouldn't bleed through to your clothes. If you see spotting before your full flow period arrives, this is actually considered part of your previous menstrual cycle. Your next menstrual cycle begins the first day of full flow, and this is recorded as day 1. So if you notice spotting before your full flow begins, you will mark this in your period app or your calendar as spotting, not as the first day of your period. Spotting before full flow can indicate inadequate progesterone levels, as there isn't enough progesterone to sustain the lining of your uterus. And that brings us to the third period sign to track, which is the duration of blood loss, or how many days you bleed for. Periods can last anywhere from 2 to 7 days. Your period will naturally taper off, but ideally we don't want spotting for too many days. So ideal healthy flow is 2 to 7 days. 1 to 2 days of bleeding can be considered scanty, and it could for some cause difficulty in trying to conceive, but not always. And it is certainly not normal and not healthy to be bleeding for more than 7 days. So if you get your period on a Sunday, by the following Sunday there should be no more blood. It should be finished. And the fourth period sign to track is the amount of blood. We're going to run a little experiment here. Before I tell you how much blood you would expect to lose in one period, I want to find out what you think first. Comment below and let me know how much blood you think you lose each menstrual cycle. So here I put out some sample amounts for you. Here we have 50 milliliters. Here we have 80 milliliters. And over here we have 200. How much blood do you think is normal to lose over the course of your whole period? No cheating. I'll give you 5 seconds. 5, 4, 3, 2, 1. Are you ready? The average amount of blood a woman should lose over the course of their whole period, which could be from 2 to 7 days, is 50 milliliters. Now, I'm just going to give you an example. That is the equivalent of around 2 tablespoons. So there you can see. This is the normal amount of blood that is expected to be lost over the course of your period of those 2 to 7 days. If this surprises you, let me know in the comments below. So if your blood loss is less than 20 milliliters, which would equal 1 tablespoon, this is considered scanty. Now, if your period is 80 mils or above, this is what we call menorrhagia, which is the medical term for heavy bleeding, and this is considered abnormal uterine bleeding. I have seen women in my practice and we've calculated that they have lost an estimated of over 200 milliliters of blood in one period. That is 4 times the amount of expected and normal blood loss. If this is you, you really need to see your doctor and find out what the possible cause can be. But the big question here is, how can you possibly measure your blood during your period? Because no one can see or compare someone else's blood loss. What is one woman's heavy bleed could be considered another's light bleed. The period measurement system uses and tracks the amount of sanitary products you use. So I'm going to bring in the whiteboard so I can give you really clear examples of how you can measure how much blood you lose each period. You'll have to excuse my terrible drawing, but I do think that having a visual representation will make it much easier for you to use this measurement system rather than just me talking at you. Now, I have drawn tampons because tampons take a little less time to draw and color in than pads, but a regular tampon and a regular pad equals the same amount of blood loss, and a super tampon or a super pad will equal the same amount of blood loss. Over here, we have a regular tampon. When they are fully soaked, they will hold approximately 5 milliliters of blood. Over here, we have a super tampon, and when a super tampon is fully soaked, they will hold about 10 milliliters of blood each. As one example of losing a certain amount of blood or using a certain amount of sanitary products, if you were to use throughout your whole menstrual bleed 10 regular tampons or pads, you would have 10 of them times 5 milliliters because each of them are fully soaked, and that would give you around a 50 milliliter loss of period blood for that menstrual cycle. Now, to represent the equivalent amount of blood loss, if you were to use 5 super pads or tampons that are fully soaked, you are losing 10 milliliters of blood every tampon, and that will give you 50 milliliters of blood loss for that whole menstrual cycle. Now, I know it's not this quite clear cut, so it can get a little tricky, and we can measure based on whether the tampons or the pads are half full. It is a guesstimate, but it gives us a little bit more accurate information. So another possible way to measure blood is if all of the tampons are still, or pads are still regular size. This particular example, there are 5 fully soaked regular tampons. For the end part of the cycle, there are still another 5 tampons, but they're about half full. So we have 5 tampons with 5 mils of blood fully soaked. That's 25 mil blood loss. Then we have 5 tampons, they're half full, so each of them contain about 2.5 mils of blood, and that is 12.5 mils. So if we add these together, this period would be blood loss of 37.5 mils. And some people need super and regular, or a mixture of both. Here I have another example. We have 3 super tampons. They hold 10 mils of blood each. So for this blood loss, we have 30 mils. Then the next 2 tampons are regular tampons. They're still full, so that's 2 times 5 mils, so that's another 10 mils lost. And then at the end of the period, when it gets a little bit lighter, there are 2 regular tampons still, but they're half full. So we have 2 tampons times 2.5 mil, and that's 5 mils of blood. So when we add this whole menstrual cycle blood loss up, we have 30 plus 10 plus 5 mils, and that is an estimated blood loss of 45 mils. Now, try to remember back to your last period and calculate your blood loss on what you remember based on the sanitary products you used. And what is your number? Are you losing an average amount of blood per period, which is around that 50 mils, that 2 tablespoons? Or are you losing 80 mil and above, and it's time to see your doctor to let them know and to discuss what could be causing your heavy periods? So to recap, healthy and normal amount of blood loss for one period is 30 to 80 milliliters of blood, an average of 50 mils. And what is not healthy and not normal blood loss is anything under than 20 mils or anything over than 80 mils. Now, without using the measurement system, there are a couple of red flags for heavy period loss. You shouldn't need to change your pad or tampon within 2 hours, and certainly not hourly. You shouldn't really need to change your pads at night. Blood loss should slow down at night, and you should never ever need more than 1 tampon at a time. And you shouldn't worry about leaking through a pad or a tampon onto your clothes within 1 hour. You shouldn't be soaking through your period undies within a really short time frame, and you shouldn't be bleeding through to your clothes within a short time frame either. And there is another possibility when it comes to blood loss. If your cycle is really regular and the flow of your period is very similar from period to period, and your overall health is really great and there's been nothing detected that could cause this heavy period, this could be considered normal for you. But it is really important to rule out the possible causes of menorrhagia. And the 5th period sign to track is the consistency of period blood. It may surprise you that your period is not just blood. You also lose endometrial tissue, which is bits of the uterine lining. You will also lose cervical fluid or vaginal secretions. But your period should mostly be liquid. A few small clots or stringy bits can be considered healthy and normal. So as the measurement system for the consistency of blood, I get women in my practice to compare their blood clots to the size of our coins or our money. And in Australia, we have a 5 cent, 10 cent, 20 cent, and 50 cent piece. If you see blood clots in your period that are 2 centimeters in diameter or bigger, it is time to discuss this with your healthcare practitioner. Usually, heavy bleeding and larger clots are seen together. This is because when you get your period, your body also releases a natural anticoagulant, which prevents the blood from clotting and allows the menstrual blood to form a liquid. However, if your rate of flow is heavy, it is likely that the anticoagulants haven't had enough time to work yet, and you could see larger clots than 2 centimeters in diameter. And that brings us to the 6th period sign to track each menstrual cycle, and that is the color of your period blood. Now we're really getting into the nitty-gritty here. The faster your blood flows, the redder it will be. So your first blood flow will typically be bright red because this is usually your heaviest and fastest flow. After your blood loss slows, it will typically turn to a darker brown or a lighter brown color, which is what you see on your sanitary products because the blood has then been exposed to the air. What we don't want to see is black or tarry looking blood, as this blood is considered old blood and it's definitely become oxidized. In this circumstance, the blood or the uterine lining is not being shed efficiently, and therefore a sign that the endometrial lining is not optimally healthy. The black tarry period blood loss could also be a sign of infection, so it is a really good time to check that out with your healthcare practitioner. So it is ideal for your period to start out bright red. It can then move to a darker red, and if it shifts to a darker brown or a lighter brown later in your period, this is considered normal and healthy too. That brings us to the 7th period sign to track, and that is period pain. In my 10 years in practice, I am constantly blown away by what women put up with each month because it's what they're used to and they think that it is normal. If you have any period pain or cramping, it should be minimal. The prostaglandins that help with vasoconstriction can produce some kind of pain and contractions. But period pain should not be interfering with your life. You should not be missing school or missing work or having to miss social events because the pain is so severe that you can't leave the house. You should not be needing to take excessive pain medications. If this is you, please see your healthcare practitioner please try to understand why this is happening and see if they can get the right treatment to alleviate these symptoms for you. I do think it is important to track pain each month. Whether it's lower abdominal, back, or leg pain, I get all of my patients to rate their pain on a scale of 0 to 10. Now, 0 is no pain, and 10 is excruciating pain that is interrupting and interfering with life. And even when you are taking pain medications, it's not alleviating all that pain. That's a 10. It is also not normal to be taking pain medication and to not get relief from that. If you do experience pain like this, it could be endometriosis, but this needs to be ruled out and diagnosed with your doctor. Also, track the type of pain and how long the pain lasts for. Is the pain continuous, or do you have spasmodic cramps that last in short bursts? Period pain that is considered normal is when it happens just prior to your period and might last the first day or two. It could be considered normal if it is relieved by simple measures. It is considered normal when it doesn't affect your daily activities of school, work, or social events. And it can be normal when it is associated with your regular menstrual cycle. And the 8th period sign to track is PMS. PMS is like opening a can of worms because there are over 100 symptoms associated with PMS. And many of these symptoms can be associated with another condition or another cause. So for any of these symptoms to be listed as PMS, they must occur within the 10 days prior to your period, and they must especially happen after ovulation, and they also should be relieved within a day or two of getting your period. Common emotional symptoms of PMS could be increased irritability, sadness, teariness, depression, anxiety, anger, and common physical symptoms can be pimples, sleep disruptions, sore breasts, headaches, or food cravings. Record all your PMS symptoms and track what days you experience these signs and symptoms of, and after tracking for a few menstrual cycles, it will become really clear whether this is PMS or not. Yes, symptoms of PMS are common, but they don't have to be normal for you. Sometimes these symptoms can be a way of your body telling you to take better care of yourself. The good news is the symptoms of PMS respond really well to natural therapies. First, make sure these symptoms are happening after ovulation and they stop once your period arrives. And then stay tuned, hit the subscribe and the notification bell so you can find out when my PMS video comes out with all of the handy treatments. So before getting to the 9th period sign to track, I first want to talk about what you should do if you are experiencing a menstrual cycle length or a bleed that is not normal and not healthy and is raising red flags. Basically, seek help. If you determine something is not normal or healthy about your menstrual cycle or your period, it is now time to seek help from an experienced hormone health practitioner. Here you can ask further questions to try to understand what is happening for you and try to understand what is causing these hormonal imbalances. I am very aware in my 10 years of practicing as a naturopath, when some women seek help, they don't feel like they're listened to. Please know that if you are not happy with the information and the solution being offered, you can always get a second opinion. You don't need to do this alone. It is really important to feel supported and heard. Any of these signs and symptoms could be a possible hormonal imbalance. You might not be producing enough of a particular hormone, which can imply that your eggs are not maturing healthily, and this might cause ovulation problems. Some of these signs also indicate poor endometrial lining health. Others can indicate nutritional deficiencies or autoimmune conditions or just low-grade inflammation. Please find someone who will support you, and please spend the time to understand your body and learn your menstrual cycle better. A great place to start is with my Master Your Menstrual Cycle course, and the link is in the description below. Please comment below so I can answer your questions and help you on your health hormone journey. So far, we've covered the length of your menstrual cycle and all of the signs and symptoms related to the actual menstrual bleed. Last but not least, and actually my favorite, the 9th period cycle sign to track is your cervical fluid. This is a topic all by itself with enough information to fill its own video or 2 or 3. But for completeness, if we are talking about the signs and symptoms that you should track around your menstrual cycle, This is as important as the rest. Cervical fluid is what I call it. Most commonly it's referred to cervical mucus or vaginal discharge, but most of the time it's not spoken about at all. I have 40-something-year-old patients with 3 kids and never knew that cervical fluid was a thing. On the opposite end of the scale, I have some women that don't know that this is healthy and happening in response to hormones, and they think that they have thrush or some unhealthy discharge. So it's important we talk about it more. There are 4 types of cervical fluid, and we will see and feel this cervical fluid for about 3 to 6 days leading up to ovulation, and it happens in response to increasing estrogen levels. The purpose of the cervical fluid is to make the vagina a more hospitable environment for the sperm, and it helps the sperm on their journey up to find the egg. So the 4 types of cervical fluid: 1 is sticky. This is like a clumpy glue consistency that's very tacky. 2 is creamy cervical fluid. This resembles like a hand lotion. It has a smoother texture, but it still doesn't stretch, and it still can be a white color. Then we move on to 3, which is egg white. Now this looks like an egg white. It stretches like the egg white and it doesn't break apart. And this now usually turns to more of a see-through or an opaque color. And then we have the 4th type of cervical fluid, which is watery. So it's really hard to kind of see, but you can tactile feel it. It's very lubricated and it will glisten in the reflection of the light. You can mark down the different types of cervical fluid in your period app or on your calendar. This gives you important information that ovulation is approaching. You can either see this cervical fluid on your underwear or as you wipe with the toilet paper, or you can also insert your fingers to check and see exactly what there is. You can also track your vaginal sensation. And what do I mean by this? So take notice throughout the day of the feelings around your vaginal opening. Sometimes it can feel very slippery or wet or cold, and when you have these sensations, it is very probable that cervical fluid is present. All these types of cervical fluid are healthy and a sign of healthy hormones. However, if you see any different color changes where it moves to browns or greens, or if there is some odor that is very distinctively different, it's now time to see your healthcare practitioner to find out what can be the cause. This video just touches the surface of information on cervical fluid. Find out what cervical fluid is, why we have it, and what it says about your fertility. I'll go into more details on the 4 types of cervical fluid, plus I'll give a demonstration of what they look like to make it so easy for you to identify your own. So check that out next.